Welcome back to Life at the Spectrum. I'm your host, Gina Cavalli, and a couple months ago, I had on a great doctor who goes ahead and diagnoses a very rare, however growing, kind of profile within the autism spectrum disorder umbrella, and that's called PDA. And if you didn't see that episode, go back and watch it because it is kind of growing as more and more people are getting diagnosed with that PDA profile with being on the spectrum. And by the way, ABA therapy does not work on PDA kiddos. So you want to watch that episode. But it got me thinking, more and more families have multiple diagnoses with their children. Some have Down syndrome on top of autism. Some have cerebral palsy and autism. And I came across a family here in Atlanta who has a son that has a very rare condition called Myhre Syndrome, in addition to being on the spectrum. And so I would be remiss not to address this as it's kind of now getting a little bit more and more diagnosed across the country and the world to bring on one of the leading experts in the field. Please welcome to the show Dr. Angela Lin. She is a published author in journals. She is a geneticist. She is a leading expert in this very rare Myhre syndrome, and she works at the Department of Pediatrics at Mass General Children's Hospital, which is part of Massachusetts General Hospital. Hi, Dr. Angela. How you doing?
I'm doing well up in Boston. It's almost as hot as down there, I think.
Oh, my gosh. It is brutal, and summer just began. Hey, Dr. Lin, explain to everybody what Myhre syndrome is.
Sure. Myhre syndrome is a genetic disorder. It is caused by a mutant gene called SMAD4. It was described by a woman named Dr. Myhre in the 1980s. So it's actually a fairly recent syndrome. It's very rare. I've had the privilege to examine over 50 people at the Massachusetts General Hospital where I work. And in the United States, we guesstimate, because we're not sure exactly, that there are probably about 300 patients. We think this number will increase as people get diagnosed in the future.
And how many people have this worldwide that we know of?
That's an even bigger guess. It's always important that I be very honest with what we know and what we don't. We could certainly say probably 1,000, but the number that have been identified and reported in medical journals is only in the hundreds. So I'm just guessing that because of better technology, increased awareness, this will increase rapidly. But not everybody has the same access to testing that we do in the United States. And so that limits it in some places.
Would you say there are pockets or areas in the country and in the world where there are more Myhre diagnoses?
That's an interesting question. It's not. It does not favor any particular ethnic group. It might be more diagnosed in areas where you have tertiary care medical centers. In the United States, we certainly have these centers everywhere, Boston, Philadelphia, Texas, Cincinnati, West Coast too. So there are plenty of places. And people who can go to those centers to be examined because of autism or other problems will get diagnosed. It doesn't mean that people in a rural area won't get diagnosed, but access to these centers does help.
And what's the average lifespan for a Myhre patient, if there is a lifespan?
That's a really good question too. And the reason I have to pause is because Myhre syndrome has a huge spectrum. We have some people who are living well in the sense that they can marry. A very few have had children. But for the most part, this is a very difficult syndrome. I think the people who are listening who have a child with Myhre syndrome or who live with it understand. And so there are many issues to think about: the ability to think, to relate, so that would be cognitive or social disability, the ability to deal with the medical problems, which are considerable. There can be problems with the heart, the aorta, joints, the airway. And so everybody deals with this in a different way. And therefore, that affects what I say about lifespan. People who have some of the most serious problems will have a shortened lifespan. It's a really hard reality, but that's true. And for the longest survivors, we do have people who are in their 50s. And we hope that over time we'll see more in the older age group. But people who are living that long, 40s or 50s, certainly carry a considerable medical load.
So with many Myhre patients and that diagnosis, they also have an additional diagnosis of autism. And Do you know the numbers on that when it comes to Myhre and autism?
So I've been giving a lot of thought to that because, of course, that's the topic of your show. So we wrote a paper that was just published. It was called The Emergence of the Natural History of Myhre Syndrome. So natural history implies what do we know about a person or a disorder over time? And we're just getting there. That's why we called it the emergence. And in our study, most patients, most people who have Myhre syndrome have some social disabilities, maybe about 70-75%. But this only reflects the patients that we saw. Now, our series is the largest in the world. It was 47 patients personally examined. They came from the United States, Canada, South America. So we do have sort of a representation. But that's hardly the representation of the full spectrum of Myhre syndrome. So when we say 70%, first of all, that implies those that were well examined, had formal testing, or strongly supported. So we don't allow somebody to report Myhre syndrome as just a checkoff option. We have to review all their records. So if somebody had a formal neuropsychologic evaluation or developmental evaluation, we might find that their frequency is actually higher. It's possible, though, it could be lower because Myhre syndrome has a spectrum. And if the number of people at the mild end are increasingly diagnosed, as well as those at the severe end, we're going to broaden that spectrum. I doubt that we would ever say Myhre syndrome has 100% autism. I doubt that we would say 20%. And so I think 70% is a good starting point. It might be 50 to 70%. And of course, as you know, it's a spectrum. So there are people who have absolutely classic Myhre syndrome in terms of behavior and can be quite severe. Some of our patients are nonverbal. But there are others who are quite verbal, very expressive. So it's a huge spectrum. I don't want to leave people with just one definition.
And it can be hard for parents who have children just with Myhre syndrome, autism, cerebral palsy, pick a diagnosis and then add an additional diagnosis to that. It can be extremely difficult for parents to just navigate getting their children into school and then onwards and upwards after that.
So that's an important concept. In other words, some of our patients come to us because they've had a diagnosis of autism, and by their neurologist or the developmental or geneticist, they've been found to have Myhre syndrome. So you start with autism, and now you have Myhre syndrome. And some people react to that with, they're actually satisfied. Finally, it explains why my child is different. Other people are crushed because this takes away any hope that what their child had might go away. So a gene does not go away. At the other end are people who have Myhre syndrome. And as part of the counseling, we talk to them about autism spectrum. For people who already have a child and they've suspected it, there's actually satisfaction. People will say, finally, you believe me, other doctors have not. This is what I think. And as I said, the other side would be people who are just crushed. You know, are you sure? And we always try to be as sure as possible. What I might see in the clinic is only a sample. We need the formal testing. We need the parents, and we also need the teachers, of course. And I just want to encourage parents, always tell the doctors your thoughts, give them examples, give them anecdotes. I am forever learning about autism. I will never be as smart as any of you listening. And every little story that you tell me means a lot to me. It helps build up my knowledge base.
With me today, Dr. Angela Lin. When we get back, we're going to find out a little bit more about single abnormal and gene deficiencies and what all that is all about. Stay with me.
Hi, I'm Brad Grzelka, owner of Atlanta Swim Academy.
You really don't have a program like this anywhere else.
Very passionate about water safety and providing the best swimming lessons possible in East Cobb.
Make it all fun and get them comfortable with the water.
We are
Atlanta Swim Academy. Atlanta Swim Academy.
Atlanta Swim Academy.
Woo!
We are Atlanta Swim Academy.
Welcome back to Life with the Spectrum. I'm your host, Gina Cavalli. With me today, Dr. Angela Lin. She's in the Department of Pediatrics at Mass General Children's Hospital, which is part of the Massachusetts General Hospital, correct?
Yes. My position is like having a concentric circles. So I work within a hospital system called Mass General Bringham. We are Massachusetts General Hospital. And the pediatric area is the Department of Pediatrics, Mass General for Children. I'm in the Division of Medical Genetics, and within that is the Myhre Syndrome Clinic. So think of nesting.
I wanted to get to the information that you and I spoke about on the phone because you had given me a lot of insight as to, why it's so important to get testing and the different things that come along with that. And I'd love for you to share with our viewers some of those 5 things that we discussed off the air.
Thank you, Gina, for giving me this opportunity. And as we've said, the purpose of my continuing to speak is not so much about Myhre syndrome, but just about having a child who's on the spectrum and whether anything could or should be. And the bottom line is it depends on you. So when we talk about having a child who's different, whether it's autism, whether it's hearing loss, visual loss, heart problem, some things in life really just happen. So I throw up my hands. It just happened. I can look to the sky. More and more we're learning, though, that those events have a known cause. And so I'm going to try to paint a word picture. Our body is made up of different organs and cells, and within the cells is a center called the nucleus. And in the nucleus are these structures called chromosomes. They look like little caterpillars. They look like they have a barcode. So one category of a cause for a problem is a chromosome abnormality. And that means that the chromosome number could be increased, as we see in Down syndrome, decreased, as we see in something called Turner syndrome, or just missing a part. That's one category. The next category is something smaller. So smaller than chromosomes are all the genes that comprise a chromosome, so many of them. And so we can look for gene problems. Some gene problems happen just out of the blue. We call that sporadic or de novo. Others have been inherited from a mother or a father, so passed along. Some genes require 2 copies, one from mother, one from father. That would be something like cystic fibrosis. And there are occasionally genes that are passed from the mother to the son. Just as a side comment, Myhre syndrome is caused by a single gene. Usually it just happens. Occasionally we're seeing it now going from a parent to a child. Another type of a cause for a birth problem, a defect, a functional problem, is something that we call a teratogen. That's a long, fancy term. That means that the fetus was exposed to an agent that caused a problem. Sometimes people think there must be thousands of these, but it's actually a small number that have been proven. So a proven one would be alcohol. So fetal alcohol syndrome can cause problems. Something called retinoic acid, which is used to treat a type of very bad acne. And there are other causes that are kind of rare, something called a mitochondrial abnormality, different from the nucleus in the main part of the cell. Within there are structures called mitochondria. They can have defects. I think that pretty much wraps it up. As I said, there is a possibility that something happened for no good reason. Sometimes we call that multifactorial. There might be some genetic predisposition. There might have been something that was part of the pregnancy. But more and more, this is what makes genetics very important, very exciting, is we're chipping away, we're finding the causes. And so for somebody who has autism, a child with autism, we do encourage that the person be evaluated by a geneticist. Some people choose not to. A lot of it depends on what information you are seeking. And it would help give you an answer about the person, or if the person is able to have children, whether that could be passed along, or whether if the person had an affected parent who seems to be affected, it would be a way of sort of tracing. Some people don't like that idea. They feel that it causes problems, but other people will drive for it. I always say that when I work with a family, it's like us taking a walk. I don't want you to feel that you're dragging me along. Dr. Lynn, we need to do this. At the same time, I would never want to drag you along to say, you need to do this. We're taking a walk, and hopefully we're at the same pace to say, this is what we could do or should do.
When it comes to families just giving birth, and what types of things should parents look for immediately to get their child? Because now, just like recently, the Marcus Institute came out with a study that said they can diagnose as early as 1 year old and put your child on the spectrum because of an eye gaze situation. Like, what do you think parents should look for across the board, whether it's being on the spectrum, Myhre, Down syndrome? I mean, are there little certain things that are triggered that say, hey, that's a marker, like you might want to go to the doctor outside of your general pediatrician?
Gina, that is a hard, big question. But I'll tell you something. I'll tell you something I really have faith in. I listen to mothers. As a mother, I listen to mothers. And sometimes when I'm talking to somebody, I'll say, how did you feel when your child was born? They might look at me, they might become tearful and say, there was just something about that child. I just didn't quite bond. I tried so hard. I tried in every way to bond, and we just had difficulties. Or sometimes the mother will say, I was able to feed my child, but I would look and say, my child looks a little bit different. I can't put my finger on it. So they sound like soft signs, but I think in retrospect, when you pull them all together, they're good signs. And in fact, sometimes the diagnosis is made by a lot of little things, not just one. For example, not quite bonding, weight low, not feeding well, looks a little different compared to my children, to me and my husband, and so on. Does that make sense?
Oh, sure. I mean, I'll use Lyric in this example. When we went to a pediatrician, his pediatrician, she immediately said, he has high tone, he has low tone, he has every kind of tone possible. And at one, we went ahead and had an MRI done and a CT scan, and we ruled out everything that we could. And that's when the doctor came back and said, listen, it's too early, because this is back then. It's too early to say this, for sure and definitively, but we've cleared him of cerebral palsy. We've cleared him of this, that, and the other. But I think he's going to be on the spectrum. So I just want to prepare, and we want to get that early intervention as soon as possible. And like the next week, all therapists descended on my household, which was great. And Lyric wouldn't be as far as he is today without early intervention. So no matter when you get a diagnosis, the earlier the better. And if you do feel something is off with your child, definitely take the steps to see what you can do for him or her. One last thing, Dr. Angela, you had mentioned how important it is to do genetic testing. Do you feel, because it's very expensive and oftentimes not covered by insurance, why? I know you can't speak for insurance companies. I understand that. Why is it so expensive, though?
It's really complicated. It's really intensive. And for in the olden days, if you wanted to just test for, say, I'll use an example, Down syndrome. It means an extra copy of number 21. You collect the blood, you put it on a slide, you look under the microscope. We're so far beyond that. What we do is we do gene sequencing. And you're not sequencing just one gene usually. You're sequencing either a panel or hundreds or thousands. This is tremendously labor intensive, not necessarily to run it, because that could be automated, but to curate it, to moderate it. So when the results come out, somebody much smarter than me will look at these results and say, this is a real abnormality. This is the cause of the patient that you referred to. We might find a test that comes up negative, but if we repeat it in a year, we then find additional genes. Or we might find a finding, we call them variants, and kind of not sure, it might be a variant that will be causative, or might turn out to be a variant that is of no significant consequence, but it takes time, it takes experts to be looking at it. So that's what's going on. That's why it takes so long.
Is there anything in closing that you want parents to know facing a diagnosis, or is there anything that you'd like our viewers to know about Myhre or autism or both?
You are my heroes. When I meet my families with Myhre syndrome, I have nothing really but compliments, like, you're doing a great job. Here's some more things that we can do. Parents always doubt that and I should say people live with Myhre syndrome, that they're not doing enough for themselves or for their children, but in general they are. What I try to do is fine tune that care. I might remind people, we got to check that hearing on a regular basis. We have to check the aorta. We have to check this and that. But that's my role. But the role as parenting is just phenomenal. And the tricks that parents know, the things that they teach me, just, it's just tremendous.
And Dr. Angela, how can people find you or find out more about Myhre, Mass General, autism?
Everything is online.
Where would people go?
Everything's online, Gina. You could just type in right now, Dr. Lynn, Myhre, MGH, and I would come up. And so most doctors in my position, we all have websites. We have websites that belong to our clinic, to our hospital, and you can find us. And there's usually a contact phone number down there. It's not even worth my telling you. You'll just be able to find it. Myhre syndrome itself, you will find good stuff. There are many times where people go searching for a diagnosis, and up comes this highly variable information, but there is a real community of Myhre Syndrome. We have my clinic, we have experts around the country. And importantly, there's a support group. It's not called the Myhre Support Group, it's called the Myhre Syndrome Foundation, MSF. And what a treat it is to go visit their website. I will often go out there just to see what are they posting. And so we do work as a community, as a team. But if there's anybody listening who has a child with Myhre Syndrome who thinks that they might, go to the website and look at it. My website has plenty of pictures, but theirs has more. And you can reach out to them.
Thank you so much for being on the show, Dr. Angela.
Thank you for inviting me, Gina. To the listeners, this was my first opportunity to do such an interview, and I hope I satisfy what you were hoping to hear. But thank you very much.
Gosh, after talking to Dr. Angela there, it makes me want to go out and do some genetic testing. And I think the reason that families shy away from it is because of the expense. It is terribly expensive to do genetic testing, and insurance companies don't cover it, which for whatever reason is just, it's kind of criminal, right? If your family and your child has a diagnosis, then they should be able to get genetic testing done, and it should be covered, because not everybody needs it. But wouldn't it be nice to have a blueprint of where you're at and what are things to come, right? Right? I'm just thinking out loud here. Now, I know this show might not be able to change one insurance company's mind, but if we all work together, maybe we can get her done, right? Start writing letters. Anyway, listen, thanks for stopping back by Life with the Spectrum. Each and every week, it is our sole goal to bring on leading experts in all different kinds of fields of disabilities, giving you the resources and tools, connecting you with organizations and foundations right where you live. And it brings me to my next point. If you know of somebody I need to be speaking to, make sure to comment below or send me an email. You can find me online at gcast.com. That's GKASTS.com. Thank you so much again for checking out Life with the Spectrum. See ya. Bye.